wanted to quickly run through our healthcare policy for New Jersey. And I want to take a step back for a second and talk a little bit about kind of how I'm approaching this campaign overall, which is a little bit different than anybody else that is talking about running. You are talking about that they may run, or people that are declared. The reality is that there isn't another candidate or potential candidate that has proposed any sort of idea, suggestion, changes for New Jersey. I mean, most of the other people are running around New Jersey just saying, I want to be the governor, and talking to party chair people for their support. And there's no substantive ideas or policy changes that are driving their candidacy. And we're approaching it in a very, very different way. The backbone of our campaign is being detailed in policy and really being more robust and more detailed than any campaign probably in the history of New Jersey. The reason that I say that is because there's obviously real substantive policy. There's risk politically whenever you're going out there on a limb and proposing something from a policy standpoint that may be unpopular, but you actually believe to be true. And we think it's the right thing, and we think that New Jersey deserves a robust conversation. You treat people like adults, and they could understand the challenges and what the proposals are. Every month or slightly more, we roll out a different policy platform, one of the legs of our campaign. We started with transportation, and then we did a Zoom call with the broader public. On that one, we had several hundred people. That's been the consistent kind of number of regular people that are chiming in to have conversations around what we're proposing. We've done transportation, we've done housing, we've done public safety, we are doing healthcare today, and then we are following with education around the corner, tax policy, and of course, government reform. All of them will be detailed, all of them will be clear, all of them will include things that people may not want to hear, but if elected governor, these are things that I will pursue. I also want to highlight the fact that a lot of the ideas that we are first putting forward have actually been taken up by the legislature or the governor subsequent to that. So, the CBT, dedicated revenue source for New Jersey Transit, first proposed in our policy paper when we rolled it out. Subsequent to that, the activists in New Jersey Policy Perspective echoed that sentiment. Following that, the Senate president echoed that sentiment. And then, despite the fact that the governor was pushing back every step of the way, here we are with obviously the governor being supportive of it in his latest budget. Very similar to housing and COA. COA has been dormant for decades. We rolled out our housing policy. Changes to COA and how New Jersey approaches affordable housing was a core part of that policy proposal. And, shortly afterwards, you actually see a more robust conversation in Trenton and resulting in legislation moving that hasn't moved forward in decades, I will tell you. So we're moving forward today to healthcare, and I really kind of want to outline the framework for each of these, and then we'll kind of get into a conversation around them. They're all laid out exactly the same way. What have I done in Jersey City? The best indicator of how somebody will be as a governor or act in the future is what have they done in the past on a specific topic. And I think that I have a unique background relative to any of the other potential gubernatorial candidates, just from an executive standpoint, actually dealing with these challenges in a city of 300,000 people and doing it successfully. So each of these policy papers are rolled out in a similar format. What have I done in Jersey City on the specific topic? And then later, what are the things that I think are problematic and the most important things that I want to lean into if elected governor of New Jersey? So I'm going to start here and just run through some of the things that we've done, talk a little bit more detail about them. If you have questions on any of them, feel free to chime in, and then we'll get into the things that I think are really problematic in New Jersey and where we'll lean in on the health front. When I got elected in 2013, so we're on page 3 here, one of the big things that we started to focus on was food access. We did it in a couple different ways. We focused on the seniors, doing robust tours of supermarket where we educated people about stretching their dollars a little bit further with healthy buying, and then give them a voucher to actually purchase food. So encouraging people to eat healthy, to think about what their diet is, to lengthen lives. We changed Meals on Wheels and access. We brought in that tremendously on how we deliver food and who we deliver it to. We've had initiatives like the Healthy Corner Store, where we give grants to corner stores to reposition how and what they showcase, rather than having Twinkies or chocolate bars highlighted when you're paying at the register. How do you reconfigure a store and provide the resources so that maybe an apple or more healthy eating is the thing that people see at the point of purchase? So little changes from a healthy diet, and we've seen huge success on that front. Going to the next page, I want to touch on the homeless initiative that we've had here, whether it's providing, showers surrounded by mobile showers, surrounded by access to social services in Journal Square and on the south side of the city. We're actually building new homeless shelters with wraparound services. The city's track record really has been without peer in New Jersey. A lot of people talk about combating this. Jersey City really has kind of dug in. We spent capital money and operations to really deal with the homeless issue here, and it's an issue that all of New Jersey faces. Next page, touch on marijuana decriminalization. I mean, we were, again, the first city in New Jersey to say that we wouldn't be prosecuting marijuana charges. It was before legalization. We've been at the forefront of the legalization conversation as well. New York Times actually ran an op-ed from myself and our chief prosecutor with regards to marijuana decriminalization, because we were at the forefront of that conversation. Again, I think our track record in Jersey City as an executive is really kind of pushing the envelope and really to push boundaries out of the comfort zone in order to further good policies that help New Jersey residents or Jersey City residents. Prisoner reentry, again, this was started, the New Jersey Reentry Corporation was started as an extension of our employment and training when I hired Governor McGreevey in 2013. It's obviously expanded well beyond what we did over here to a statewide program, but the initial point of creation was a byproduct of him working closely with our employment and training when I hired him to be a part of that. Our senior affairs, expanding services to seniors. It's something that I touch on later on, also how we're going to change how New Jersey funds some of this stuff. But again, a successful track record here in Jersey City. Next month, we'll be opening our first new senior center in 40 plus years. Again, expanded services in there and resources for seniors. And it's going to look like nothing that the city has ever had before, or pretty much what probably any other city in New Jersey has with regards to a modern senior center. Veteran services. Again, outreach here beyond just housing. Recently, we've put in place a suicide prevention line and resources around that. It's something I touched on in our State of the City address. And it's something that I think, again, replicated. I'm a veteran, obviously. My service in the Marine Corps is a very, very important part about who I am and what I believe in. And it is something, again, that we will expand citywide, statewide. Again, looking at track record, a lot of people talk about women's health and access to more resources. We partnered with Planned Parenthood, the only partnership like that in the state of New Jersey, via our WIC program that services our most vulnerable residents, immigrants as well, and expanded with our grant and partnership a huge array of new resources to these people. It's outlined over here, but really, really important. And again, our track record speaks to that. Domestic violence prevention, another part of our HHS that didn't exist prior. It's not only something that's an intervention in the court system that I touched on in our criminal justice and public safety platform that was rolled out last month, but it's also something that we have workshops and we have hundreds of people going through to intervene prior to an incident or help people with the proper counseling. It's another program driven by the city, and it's a model. And again, when you talk about improved healthcare access, the city has been at the forefront of improving, expanding healthcare, whether it's to our LGBTQ plus community. We were the first to expand trans healthcare options, to just expanding resources of day-to-day coverage and thinking about our healthcare policies. As we talk about healthcare policies, I'm sure later on we're going to talk about the state health benefits plan. That's not in here, but I'm happy to talk about it also because, again, there isn't another candidate for governor that has the same experiences with dealing with these things hands-on from an executive standpoint, nor is there another candidate that's even proposing any ideas that would move people forward. So the goal is to be a substantive and really clear difference maker for New Jerseyans in the administration starting in 2026. So let's talk about kind of how this is laid out here. The first part is really focusing on early childhood and the first year of life. There's a couple things here that are really substantive that I think New Jersey can change, which are really important. I'm a parent to 3 kids under the age of 6. I have a 5-year-old, I have a 3-year-old, and I have a 4-month-old. So I certainly know firsthand the challenges around childcare, around working parents, as my job is obviously being mayor. My wife built a successful physical therapy practice. She has 6 locations. So she's managing that day in and day out. And I understand that the challenges are very, very significant for people, certainly in our most vulnerable state within our city and our state. Paid leave. This is something that Jersey City has done unilaterally. We've expanded beyond the state's mandated paid leave program, and it is something that I think that we should do day one in a Fulop administration. I out here expanding from 12 to 24 weeks and expanding from 85% to 100%. This is something that's not done via cost to the state. It comes out of your employee tax or fee that they pay out of their payroll. But ultimately, it is important to creating those proper bonds in family and giving people the resources that they need to provide proper childcare. I talk in the next thing about kind of all of the different patchwork of locations and subsidies that exist and kind of streamlining that so that you'd have access to that prior. The most important thing is prior to the birth of the child. Right now, most of those things that the state allows you to be eligible for, you can apply to subsequent to the birth of the child. It's very, very important to streamline that stuff so you could have access to dollars on day one of the child's birth. Today, New Jersey doesn't do it. It's a simple change that is manageable, but it would have a huge impact to new families or families with newborns. Childcare reform. This is really one of the biggest places that I think New Jersey can do better. We are capping the cost of childcare here. And we would obviously, I outlined how we would pay for that, expanding the care assistance programs that exist. It's a patchwork of federal grants today. If you actually look at the 2025 budget, you see an increase or projected increase in the number of children that will be in these child cares, and you see a flat or reduction in dollars. So it's really less money going to children today. What we outlined here is addressing the supply side of childcare providers, how they're compensated from enrollment-based to more of a attendance-based. And then finally, expanding the dollar amount that the state subsidizes so that people have access to good daycares regardless of where they are. Today, there's a disconnect between the number of seats and the need and the actual costs that go to parents and how they pay for it. Moving forward, talk a little bit about early intervention and the laws on how New Jersey deals with children that require early intervention. Obviously, there is a shortage of providers. We talk about simple changes to the rules on expanding the number of children that a provider can work with. Very, very important to those families. And secondly, New Jersey outlines a cost sharing program, which is scary for many parents. Early intervention is crucial to a child's development. So I think that eliminating that cost sharing is really important. And the reality is that most of those parents never actually pay their share of the cost sharing, largely because a lot of the time they're vulnerable families. So it really is important that we don't.
Brent back in.
Oh, Brent. Okay, hold on. We lost Brent. How do we get Brent back in? I'm going to ask somebody who's better at tech than I am.
That's scary. Um,
Okay. Brent, you're back, I think. Brent, you with us? I think so.
I think been muted.
All right, all good. Integrated public health systems. I mean, look, if you take a step back, New Jersey, in many ways, people pay a corruption tax and it impacts your healthcare. If you look at the army of lobbyists that Horizon has and how they deal with healthcare and reimbursement, or you look at the hospital systems, the monopolies that have grown in New Jersey over the last decades are fundamentally not in patient outcomes in their best interest. It is hard to argue that the elimination of competition is a good thing, and especially when you see hospitals now aggregating and acquiring private practices and controlling leakage, as they would say, on who and how and where people can go. Those things need to change, and we will be vocal about that as governor. I'm very clear here, and I think some of the larger interest groups may not like that, but it is important to moving forward. Supporting nurses. There is legislation around minimum requirements on staffing. I think that is very, very important, but it needs to also be done complemented with legislation around controlling the traveling nurses situation. Traveling nurses were meant to be a type of supplemental help for people that are legitimately traveling long distances. Today, it has become a way for some people to game the system. They travel very short distances, but the cost to the hospitals are astronomically more than the day-to-day nurses that are part of their workforce. And New Jersey needs to control that because that is a cost that obviously all of us incur. Medical debt relief. I think it's something important that Governor Murphy started, and he's done. It's good that he's doing this. It's something I would like to expand. I put it in there because I do want to recognize and give credit there. Reproductive health care and abortion access. I talked a little bit about earlier about some of the partnerships we've had with Planned Parenthood. It's important to recognize that Governor Murphy has done a good job here, and I think that we would expand further the good work that he has done on that front. Senior care. Look, how New Jersey has a patchwork of Medicaid offices, county by county, and how reimbursements get done and how facilities are eligible for dollars from the state for improvements. All of that impacts senior care. And I outlined here how we would streamline that and change kind of how the delivery of dollars actually goes. And that ultimately will improve care. It's not at a cost, but it is something that you'd have a huge outcome of. And then finally, we're into the time and we'll have a conversation. We talked a little bit about, mental health and harm reduction and providing more resources around that, particularly on, people that have addiction issues, how they have access to housing, how HMFA actually provides that, what type of incentives they use, how would you change that to encourage more people to get into a path that's better for themselves and their families. And so that's broadly what we talked about in here. All things that I think are attainable and doable, all things that we're committing to doing, and continuing to kind of be the only gubernatorial candidate that has any sort of policy initiatives at all. All right, let's have a conversation if anybody's interested.
Yeah, always interested, Steve. Nice to hear from you. So now you said an interesting thing just a minute ago about this corruption tax, as you put it, talking about health insurance and hospital costs. Can you just elaborate on what you mean and what you could do to change that?
I mean, yeah, New Jersey, let's start with Horizon and their army of lobbyists, and some of them overlap on government interests. And you take a step back and you ask yourself things like when Horizon moved away from their nonprofit status at warp speed, why did that happen? And would that happen anywhere else? And is that in the best interest of people like you and I? when you look at who controls the state health benefits plan and some of the basic things that could be changed, for example, how the third-party administrator Horizon acts, how they negotiate with hospitals, why the state isn't allowed to negotiate directly with hospitals, why when Horizon, when you have a claim for $50,000 and they put it down to $10,000, they share in that 40,000 savings. They share in 50% of that. Those are all costs that normal people incur, okay? And because you have such a close intertwinement between politics and lobbying and government influence, okay, ties into a lot of the conversation we're having about the line right now, as a matter of fact. All of those things converge, and it ends up being a corruption tax in many ways. And people pay that day in and day out. And healthcare is a large part of that.
All right, thank you.
Hey, Dehan from Politic here. Just really quick, you mentioned the Horizon reorganization. So is that something that you would want to undo as governor?
I don't know what you could legally undo. I think you do need to unwind some of the overlapping influences between how Horizon does businesses and how they work in coordination with some of the hospital systems. Horizon today has a unique ability to select winners and losers. Like if you take a step back, the Omnia program on how they decide which hospitals are good and which hospitals are bad, that shouldn't be Horizon setting the rates based on reimbursements that they prefer based on their relationships. It was hard when they put those in place to kind of get your head around how they chose winners and losers there, because a lot of politics ultimately came into that. And that is not good for patient outcomes, ultimately. So I think that you do need more oversight there, and you need to recalibrate the relationship on how that works. And I don't think that in Trenton, anybody's doing a good job on that. I think you might have touched on, Daniel, that the state health benefits plan is going through another tough year potentially, right? And there are a lot of things that you can do to recalibrate that. I mean, I touched on the reimbursement situation. I touched on how they negotiate with hospitals. They should have direct contracts with hospitals. You know, how you deal with generic drugs. A lot of room for improvement there that we've done in Jersey City that don't exist at the state health benefits plan. And I think it just is somebody digging in and saying, hey, we are going to be a substantive administration. I know how these things work because I'm involved with them today. And that's why we're rolling out these sort of policy initiatives from the get-go, because we want to be substantive and we want to do it one at a time to actually have a conversation around it.
Okay, and you mentioned minimum nurse staffing ratios.
Yeah.
Is that something that you want to pursue legislatively? And
Yeah.
say to hospitals who have opposed this for decades, who say that this is this is a burden for them. Some of them say it's an impossible mandate given current nurse shortages. So how do you respond to some of those criticisms?
Yeah, first of all, I mean, some of these hospitals that have consolidated are multi-billion-dollar organizations. Let's start there, okay? Number two is I do touch on the fact that the traveling nurses have an impact on this as well, and that needs to change. I mentioned that earlier. So I think that that is an important part of the conversation. And then third, the priority should be patient outcomes. That is the priority here, okay? And there's no question that stability and minimum staffing lead to better outcomes. I mean, there's no question about that. And I would think that that should be changed legislatively, and I would lean into that as a governor.
All right. And just one other thing, you were mentioned you're critical of hospital consolidation.
I am.
What exactly would you do as governor? And number two, you helped broker the deal on Hudson Health System, which is still in the works.
It hasn't been approved by the state, number one. Hudson Health System would be solely based in Hudson County. You are seeing now hospital systems that are 4, 5, 6 counties large, and you've seen an entire elimination of competition in that space. So I touched on earlier that you also see those hospitals aggressively acquiring private practices and then controlling the leakage on who refers to who. And that whole linear or vertical integration without competition and without patient choice ultimately impacts patient outcome. I would be much, much more cautious and difficult on moving that stuff forward.
Mayor Brent Johnson here. We just saw this big report come out of Murphy's administration on the COVID response and how they're not prepared for the next pandemic. Have you had thoughts on that in relation to healthcare and how what kind of steps have to be taken to improve that for future administrations?
I haven't finished this report in earnest, Brent, so it'd be hard for me to like criticize everything that, you know, Governor Murphy did. I mean, I was in a situation similar as an executive where you were trying to make decisions based on what you see on the ground. There are things that we disagreed with the governor at the time, and the attorney general sorted them out between the state administration and our administration on how to deal with daycare centers, how to deal with some of the places that have kitchens and inspections and all of that. But you know, I would be hard pressed today to give you a good answer based on that report because I haven't finished it yet, right? To be honest.
Fair enough.
So regarding Hudson Health System now, with CarePoint Health, it seems like every couple weeks, 2, 3 weeks, there's something about how, you know, Bayonne's in the dire straits financially, Hoboken's in the dire straits financially. So is in the event that Hudson Health System doesn't go through in the next year and a half or so, what could you do as the chief executive of New Jersey to make sure that these hospitals stay open?
Look, the Hudson Health System's proposal was one of 2 potential options that are on the table, is my understanding. And there's a monitor there. There is a real impact to day-to-day healthcare in Hudson County if that is not resolved. And it is something that I do think the governor's office needs to push and move forward aggressively. It is at a point today where you see vendors and supplies not being provided in a timely way, okay? And that is scary from a patient standpoint and obviously puts healthcare at risk. Now, the thing about closing a hospital is that even if they closed and with the goal of closing temporarily, they are very difficult to reopen. So if Christ was to close, you wouldn't see it reopen in any form, I think. And that's a scary thing for Jersey City. So knowing that CarePoint is so financially drained, we've been advocating for some sort of solution. And it doesn't necessarily matter to me what that solution is, as long as it fosters competition in Hudson County, which I think is a good thing.
Just really quickly following up, you said that Hudson Health System was one of 2 options. What was the other option?
They are exploring, I don't have all the details on it, Daniel. I get some of it, but they're exploring an option with some healthcare provider from Chicago. And I don't know all the information on who they are. I have not met with them yet, but that was another proposal there. And I guess the details matter on what they're offering. I mean, CarePoint has hundreds of millions of dollars worth of debt. And I don't know how somebody can untangle that. And certainly somebody that's not familiar with New Jersey laws, has a footprint here, or understands the political or regulatory landscape.
Do you know if that's still viable right now? And it was CarePoint that would have gone with these Chicago people?
If you're asking, could you repeat that, Daniel?
Do you know if this Chicago route is still viable? And I assume this is in the context of it would have been CarePoint being owned by this.
Yeah, no, it's CarePoint exploring it. Yeah, it's CarePoint exploring it. Absolutely. It's still it's something that's in discussion. I mean, I haven't seen that yet. They have a CRO there, which is a restructuring manager, and they're helping with the state monitor, and all of those things are in play right now, but they're trying to find a solution. I mean, I just don't want to see a solution that incurs more debt. You need to have some sort of financial solution. And I speak to the commissioner regularly. She's been absolutely great in communicating. But it's obviously a very scary thing for Hudson County. If Bayonne, Hoboken, or Christ were to close, you wouldn't see them reopen anytime soon, because it's very hard to reopen once they close. And because of how they're structured and a lack of, patients trusting them today, to be honest, right? Like, I mean, with all of the press and people concerned about their viability, healthcare delivery there has been impacted. You get into a spiral where people don't trust it, and that leads to more financial hardship. And in order to right that ship, you really need the state to aggressively intervene on that. Okay.
Yes, I'm okay, thank you.
All right. All right.
Thanks, Steve. Thanks for the time.
Dan, thank you for the time. Daniel, I was just going to say, I'm sure you can follow up, or John, with the with either CarePoint or the state and find out the name. The name escapes me of who that Chicago vendor is or operator.
All right, very good. We'll do.
Okay. All right.
Thank
Take
you.
care.
All right, Steve. Have a good day.
Okay.